Thank you all of you to join the MHSc in Laboratory Medicine Information Night. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunities to work on this land. We will start today at 5:15, and we will end this information session at 7:15. Today, we will have the program director and also the CE and PA field directors and professional to share the information.
I print the wrong way, boss.
So I would like to introduce Dr. Gotham to all of you.
Thank you very much. And on behalf of the program, again, I'd like to welcome you to this information session. And of course, the purpose of the session is to get to understand a little bit about the program. But hopefully you've had an opportunity to look at our website. And as you hear what we have to present, and even from your own investigations, we're happy to answer all kinds of questions that you would like us to do, and we will do that in the separate room sessions after the presentations. So I'm, as you can see, I'm an anatomical pathologist. My interest is in cardiovascular pathology, but I, at the present time, am the program director for this whole program. And we're very excited this year to welcome our fifth cohort of students into the program. And as you can see from my own even interest, I have interest in research in cell and molecular vascular biology and in cardiovascular pathology. And also, like most of us involved in presenting the program, we have a strong interest in education. For myself, it's in pathology. For others, it's in clinical embryology. And I'm not sure. Okay. And then we're all also have international presence by being involved in a variety of scientific organizations in both CE and pathology, depending on our specialty. Next, please. So a question that should be on your mind, and certainly is on our mind when we had created the program, is why should anybody do a Master's of Health Science in Laboratory Medicine? So that's our program. Well, first of all, and you'll hear much more about each of these points, but first of all, both the CE and the PA disciplines are highly respected careers that provide people in need of healthcare delivery with essential healthcare. So we're really a very important component of the healthcare team. So having said that, there's great satisfaction in being an important part of pathology or clinical embryology. Second, our faculty teachers are very devoted to teaching, and they have a lot to offer the students. They're highly skilled clinical, educational, and research laboratory physicians, pathologist assistants, and clinical embryologists, and members of the departments of both pathology and obstetrics and gynecology. So you're being taught by a group that's very interested in doing this and also has the expertise to deliver a really good educational program. We also, because our program is small, there are fewer students than most programs, we have extensive career mentorship, and there's opportunities to get to meet the professors and the folks who are teaching you on a one-to-one basis to network with the group and to get a lot of career mentorship as you go through the 2 years. And we also create several platforms for networking so that both the CE and PA students in the hospitals and in the clinics at the university and also in the industry around these disciplines, people from those are available to network with our students. Next, please. So just briefly, and you're going to get much more, and hopefully you already have some knowledge about that. But a pathologist assistant contributes to the diagnostic services in anatomical pathology through application of knowledge of tissue and laboratory analysis of specimens. And in the groups, you'll hear much more about how that all occurs. And you'll also hear from folks who are doing this firsthand, both at the PA and CE level. And then the clinical embryologists contribute to the clinical management via application of assisted reproductive technology in clinical embryology laboratories. So both very satisfying and fulfilling careers, which are very interesting and dynamic in nature. Next. And so I'll just end with this. The main objectives of our program is to have graduates understand the scientific basis and research that provide the foundations for these professional practices. So there is an emphasis on scientific fundamental work and on research. We wish that our graduates achieve the academic and applied skills required to work effectively in the discipline. We want our graduates to gain the ability to be excellent problem solvers, critical scholar, innovators, leaders in their discipline, and to create a moral and ethical practice for themselves wherever they land up in after the program. And most important, we're also providing graduates with the tools to be critical self-learners and embrace the changes in the field as they occur, as we move forward in medicine towards precision medicine and patient-centered healthcare. So once again, we're forward-looking in our educational activities within the program. And of course, we want to provide a valuable student experience, and that includes, as I mentioned, the mentorship and the ability of students to really enjoy being at the University of Toronto in the Department of Laboratory Medicine. We have active student groups, and this should be a very enjoyable 2 years for you. Next. So now I'll introduce Heather Shapiro, who's professor and field director of the clinical embryology field. Heather?
Okay, so you can see me and hear me? Great. So welcome, everybody. It always gives us such pleasure to see the number of people that show up on our information night. I know that probably makes you a little bit nervous thinking that you have a lot of competition. And that is because, as you heard, it is a really great program. I am the lead for the CE part of this program, but really I could not do this work without several other important colleagues, and you'll be meeting Scott Hamilton shortly. And I'd also mention Ted Brown, who is a co-leader with me. Just to echo what Professor Gottlieb has said is this is a fascinating area where you can be a laboratory scientist, have impact on clinical science, work with doctors, nurses, industry, innovation. I think innovation is in many areas a key concept and no more true than in IVF. So we learn about technologies, we learn about AI, but we also make sure that we put things in perspective, understanding the scientific basis and the ethical decision making for our specialty. So it's a great experience, but don't trust me. We have some students and some graduates who will be able to share their experiences as well. So looking forward to meeting you all.
Okay, so my name's Scott Hamilton. I'm a lab director at Mount Sinai, and I've been a lab director at a number of facilities over the years, and it's been a great pleasure to actually participate in the development of this program that grows unbelievably each year. I love it. We've had a whole bunch of great students coming through, and I can tell you most of them actually are finding jobs if they want them. So I'm going to give you a little bit about my view as an old guy, life as a clinical embryologist. So clinical embryology, it's challenging, it's rewarding. Now, Robert Edwards has been widely believed to be the first clinical embryologist, contributing to the birth of the first test tube baby in 1978. He actually had a lot of help from Gene Purdy, who some people privately believe was the first clinical embryologist. It's experienced explosive growth from that time until now, and I've watched it personally. I participated in my first egg retrieval as what we called an IVF technician then in 1990. It's evolved with individuals from research fields that mostly worked with animal science and then applied it to humans. And there was basic science background, research applications, and these bridged the gap to kind of turn it into the original clinical application of clinical embryology. And until recently, the majority, because the field exploded so fast, the majority of clinical embryologists learned essentially as an apprenticeship program. We need somebody to help. Here's how you see a sperm. Here's how you wash a semen sample to get sperm. Here's how you retrieve an egg from a tube. And then pick up some knowledge as they go along. So we have some awesome embryologists, but really it was less of a formal training program. And so now we've got an opportunity to actually develop it better. So now you can get basic hands-on experience and basic experience as well. So clinical embryology work, the input into the embryology laboratory is based on fertility treatment cycles. That might be a current cycle that a couple or an individual is going through, or it might be a cycle that involves embryos or gametes that were banked from the past. Physicians and clinical teams coordinate the ovarian and the uterine cycles to generate an optimal retrieval of suitable gametes, or I guess, the return of embryos. And embryology cycle work depends on the cycle type, but it usually involves either an oocyte retrieval or a thaw of frozen oocytes, in vitro fertilization at some point, and embryo transfer at some point. We have thaw and transfer of previously frozen embryos. We have gamete freezing and storage for future use. And there's various optional variations that can be used: frozen gametes, donor gametes, genetic testing, and the gamete actually grows each year. So clinical embryology, it's based on human pregnancy. Human pregnancy is about 280 days. The menstrual cycle is about 28 days. And clinical embryology work, so our team basically is responsible for the live process over about a week. And there's all kinds of stuff that surround that. So if we look at the normal pregnancy in human, you have the middle of the menstrual cycle. There's an egg that gets released. Let me see if I can. The egg is released to the fallopian tube. Sperm get in through the vagina, cervix, and uterus through the fallopian tube. They fertilize it in the tube. And over less than a week, there's some division that happens as it moves through the tube, reaches a blastocyst stage, which is still under a week, and it implants into the uterus. So the physician team, they basically deal with about 10 days, the first 10 days of the menstrual cycle, to actually get one or more follicles that should have a mature egg in them. Then there's an egg retrieval, and we get the material, put it into a dish, and we look after the 5 to 7 days that would ordinarily be in the fallopian tube. So here's two sides. So conventional IVF, you take a sample of semen, you prep it to get good sample of sperm. You get follicle aspirates from the clinical team that comes in the form of a tube. And somewhere in there, there's a cumulus oocyte complex. You put them together into a dish and let nature take its course. You look at fertilization the following day, you look at division for a couple of days, and then you watch it develop a little bit further, but again, no longer than a week before it either has to be transferred or returned to a uterus. And on the other side over here, the only difference is you take the same semen sample, but maybe there's very, very few sperm and it couldn't fertilize normally by itself. So you pick up a single sperm with a micropipette and you poke that into the egg. And then these pick up here again, watching for fertilization and subsequent development. The egg retrieval is it's done with a transvaginal ultrasound. So the actual probe of the ultrasound is very close to where the egg is. The physician guides a very long needle, but only a very small portion of it actually goes into the body, into each follicle, and it gets drained with some suction through the tubing into these test tubes. And this is a magnified picture of the needle going into it. And there's an ultrasound image. Follicle's about an inch at that time. So it's a fairly big thing. The egg is about 1/10 of a millimeter. And your embryologist, first thing they get on the egg embryo side of it is a tube of media that has a little bit of follicular fluid that it's red because there's certainly blood flow to the follicle. And so there's certainly blood cells that are in there. The embryologist takes that tube, and simultaneously, another embryologist or an andrologist is doing a sperm prep, which usually, but not always, comes from a semen sample. Because it's semen, it's a bodily fluid, it has to be processed in one of these biological safety cabinets. And it's a pretty simple process involving fairly simple equipment, a centrifuge, microscopes, and simple medias. Handling of the oocytes and then subsequently the embryos, it has to be done in a clean lab. It has to be done in a clean hood. You do need microscopes of varying magnifications, and the cumulus oocyte complex and even the embryo itself, they're fairly large as cells are concerned. And so stereo microscopes, which are really good dissection microscopes, that magnification is for a lot of the manipulation work, actually with your hands and little tools manipulating the oocytes. And this laminar flow head is very clean. It's got lots of heated surfaces, so you've got a good environment for the eggs and embryos to be in. Lots of nearby embryos that have good gas concentration and the good heated environment. You can do the egg retrieval and embryo transfer in something like a baby incubator. These are isolettes or IVF workstations. The only difference between this is it actually pumps heated air into like an incubator environment. And so you can work in a CO2 environment and you don't have to use the same buffered media to do it. So there's lots of options. First thing the embryologist sees when they look at the aspirate from the tube is they see these cumulus oocyte complexes. The egg's in there, it's about 1/10 of a millimeter. It's surrounded by cumulus fluffy granulosa cells. And that complex is about 1/2 centimeter. So you can see these very clearly with the naked eye. If you look under a good microscope, such as this projected on the screen, they look real nice. It looks very much like an egg in a frying pan, but the chicken egg is quite a lot different than the human egg. That's another lecture. Inside that cumulus oocyte complex, you're hoping to see a mature egg. And we know that it's mature because it's completed its first meiotic division and it's released a polar body. And this is a picture of an ICSI injection, but it's the best view of that oocyte proving that it's mature. And I've got a little movie, I hope, that will show you catching sperm for a minute or two and poking that sperm into an egg. This is done using micromanipulators. So you've actually got joysticks just like the computer game. And if you move your hand a few inches, that little pipette only moves a fraction of a millimeter. So you can make big movements up and down, back and forth, and you can take that pipette, come down on the tail of the sperm, break it. We've also got micro syringes for sucking and blowing. So you move the sperm into the pipette, take it out of the pipette. We'll just show you capturing one more sperm. They're actually very good, easy to see under a good microscope. And the micromanipulation system makes it very smooth, the motions that you do. Even if you happen to have a teeny bit of shakes from a cup of coffee, your motion gets smoothed out by the equipment that you're using. So there, just as an example, we've picked up 2 sperm, and then you move to another drop that contains the egg. And these eggs have already been denuded or stripped to remove the cells that surround them from the cumulus. And this is maybe, I'm going to say 200 times magnification. There's a mature egg. The polar body is at the top there. You can, with this equipment, roll it around so you can put the polar body where you want it. And you've got another pipette with another joystick that you can use to apply suction to hold the egg in place. And so you can do a controlled injection of pushing the sperm into the egg. If you didn't learn in your undergraduate, you'll learn in your basic clinical embryology coursework and basic science that almost all the time, right underneath the polar body, there's a little spindle containing the remaining chromosomes that are going to be used. And so you don't want to poke a needle into that spindle. So you purposely place the polar body at the top or at the bottom and push the sperm in somewhere below or above that, away from where the spindle should be. This is real time. So that's about how long it takes. And maybe there's 8 eggs in that particular dish in 8 separate little drops. And so you can move from egg to egg and poke one sperm into each one of them. And so that shows another one. So I'm just going to move on. So then after you put the sperm together with the egg, this will be a time lapse that speeds up the whole rest of the assessment process. Sorry. So here we're speeding up about 6 days into a couple of minutes. And so the sperm was poked in. That spurred the egg to continue its meiotic division and release an extra set of extra chromosomes. And it's incorporated one set of chromosomes from the egg, one set of chromosomes from the sperm. And these are called pronuclei because they're half nuclei. That takes place during the first night. Then during the next day, it divides once to 2 cells and then twice to 4 cells if everything goes perfectly. The majority of fertilized eggs will divide the first time. And then there's a bit of a selection process. So not all of them go to 8 cells. And of those that are 8 cells, not all of those compact. And of those that compact, not all of those continue to be blastocysts. Which is why we don't just take one egg from a natural cycle. Ideally, a physician wants their patient to get maybe 10 to 20 eggs to allow that selection process to provide maybe 2 to 5 embryos that can be used for multiple embryo transfers. So this is day 3. And this was a genetic testing cycle. So you didn't see it because we took it out of the incubator between the pictures, but they put a little assisted hatching hole in that, this is the zona pellucida, and that allows, under pressure, a few cells to squeeze through that hole, and these can be biopsied for pre-implantation genetic testing when they reach that spot. This is compaction. It's called a morula. That should be around day 4. You can see the cells elongating a bit, fluid being pumped into the center. This is cavitation, and now it's an early blastocyst because you're starting to see an inner cell mass and these elongated trophectoderm cells. And with the fluid pressure, some of them have herniated out, and these can be biopsied and send maybe 5 of those cells off to a commercial testing company. If it has the right number of chromosomes, it's euploid or normal, and that means that the rest of the embryo that remains is also euploid, probably, and it can be frozen and assumed to be a normal embryo. That's the fun part of the job. That's what the job is all about in terms of the goal for the patient. But in terms of getting it done, there's a lot of other components. There's maintenance of the environment, proof that you maintain the environment, proof that your system works, and lots of preparation and follow-up from your cycles. So regardless of what's being done, you have to document with lots of checklists. Every solution and consumable that comes in contact with the gametes has to be verified to be safe. We do that internally as well as with checklists from the suppliers. We have to report cycle outcomes to clinical teams, patients, and registries. So not only do we have to follow and write down what happened, we have to tell a bunch of people. Lots of different types of equipment, lots of different places where we maintain embryos. So these dewars have frozen embryos and frozen eggs in them. You have to keep those topped up with liquid nitrogen. They're connected to all kinds of monitoring systems that tell you if the temperature changed and you're not actually in the lab. There's a signaling process and a paging system so somebody can come in and deal with it. There's monitoring the temperature of the room, the humidity of the room, changing gas canisters that supply the incubators. So if we talk about the work categories, there's data entry, dish and device labeling, dish preparation. Maybe that's 50% of your life. There's patient interaction, ID verification, progress reporting, maybe 5%. Quality control, equipment function verification and maintenance, 15%. So temperature, gas readings, dewar measuring. Clinical team information sharing and communication, 5%. Outcome follow-up and presentation, 5%. In-house case studies and abstract preparation, overall probably like 2%. Some people may take a real interest and do a little more, but that's practically what it is. Complaining about workload and unpredictable scheduling, 1% of your time. The technical work, which is the fun stuff, 52%, which that's a good hunk. It's a fun job, lots of different variations of things that you get to do, and I thank you for your attention.
Thank you very much, Dr. Hamilton. Now I would like to introduce our alumni, Hannah. She will share her experience with all of you.
Hi, my name's Hannah, and I was part of the second cohort who just graduated this past November from the clinical embryology stream. And I thought I'd start off with a little bit about my academic background. So I did my undergrad at the University of Ottawa in biomedical science. And I did undergraduate research on estrogenic and androgenic effects of herbs that are commonly used in pregnancy. So I knew for a couple of years that I was interested in maternal health, and then later on narrowed it down to embryology. And specifically, I learned about embryology through a fourth-year reproductive physiology course that I found very fascinating. And then just from taking that course, I knew that this was a career that I wanted to pursue. So my time in the program, I was able to make some great friends. So it's a very small program, but that really allows you to get close to the people that you're with and have a lot of one-on-one time with them. In first year, it involved a lot of theory, and then that prepared me very well for my second year that had a lot of hands-on. So specifically, we have our skills development lab, a lab rotation, as well as a capstone project, all of which helped me feel ready by the time I actually got into a lab setting working as an embryologist. Throughout my time in the program, I also worked as a teaching assistant. And if you get into the program and this is an opportunity that you have, I would definitely take it. I think one, you get a better connection with your professors. Two, you get to meet some of the students, both undergrad and some of the master students who might be in the year below you. And then also it allows you to go back through some of the material that you learned the year before, and then teaching it definitely also helps like it stick a lot more. So I definitely think it was a great opportunity. And then I graduated this past November. So what I think sets this program apart, I felt very prepared when I completed the program to enter the field. I also found that there were amazing networking opportunities through everyone involved in the program, as well as I mentioned, working as a TA. The lab rotations allow you to meet lab directors and other embryologists, and that could potentially lead to job opportunities. You also have the opportunity to do research presentations, and you can be involved with the Canadian Fertility and Andrology Society. That's actually what led to my job, so I definitely recommend. And the program has amazing professors who genuinely care about your learning and your success. Also, the small, tight-knit group allows you to focus with your friends and then learn the material together, bounce ideas off of each other, and you get very one-on-one moments with professors. The capstone project I also found very fulfilling, and it allows you to focus on any subject relating to embryology or pathology, if that's what you're in, that you're passionate about. So you can really focus on any niche, bring ideas to the table, meet some professors, and narrow down a project. And then I also found that the program definitely equips us to think critically, which is really important in embryology. You always have to be looking at what you're doing, looking at media, seeing if things look off, thinking about the different like cycling, and just always trying to pay attention to everything that you're doing, everything that everybody else is doing. It's very important. So I started working as an embryologist in August of last year. So I started with learning some administrative duties. These involve like data entry and learning the lab flow. Data entry is definitely still a very big part of the job. So it's not just something you learn in the beginning, but it's definitely something that you have every single day. So you have to be very detail oriented and pay attention. Then I started to get trained on egg retrievals. This involves timing out a patient and then identifying cumulus oocyte complexes in the follicular fluid. I have now been trained on denuding oocytes, which means removing those cells that surround the egg, and tubing biopsy samples. Currently, I'm being trained on embryo freezing, embryo grading, and embryo transfers. I personally love working as an embryologist because it's a field that is always changing. I think in 10 years, it's probably going to be vastly different than it is now, just like it's very different than it was even 10 years ago. And I found it's really cool that it's an intersection of clinical and lab work. And you also have opportunities for research. So depending on where you work, you might get more clinical or like more patient facing. Other ones, you might just be more in the lab. And then depending on the clinic you work at, you might have more research. So you can kind of choose whatever you're more interested in and then find a place that best matches that. I also love that it's very technical and it takes time to develop skills. And I find that very fulfilling when you notice, for example, your hand is no longer shaking as much. It's very cool. And then I also find that I enjoy making an impact on patients' lives. And I feel that we get pictures of babies sent to our emails every once in a while, and it's really cool. And I also find it's cool that it's a niche field. Not everybody knows about it. If I tell somebody what I'm doing for work, then often it sparks a conversation, and I find that interesting. And every day is a new day. I'm learning things all the time. And so I really enjoy that. And thank you for having me. And later on, when we join the breakout sessions, I'd be happy to answer any questions.
Thank you very much, Hannah. We will now move to the PA stream, and we are happy to introduce Dr. Fan Liu to all of you.
Hi, hello. Hi, everybody. Thank you for coming on the Tuesday night. So my name is Dr. Fang Lu, and I'm the field director for the pathologist assistant field. And so that's kind of the education role in this program. But clinically, I'm a breast pathologist working at Sunnybrook Hospital. As you can see on the picture, that's my office. Yeah. Yeah, I also have, interest in like digital pathology, medical education research, and obviously breast pathology, like clinical research. Yeah, you will hear more about the program from our wonderful education coordinator, Mr. Will Choi. I could not have run this program without him. And also from our wonderful alumni, Paulina Goldberg. I just want to say that, like, as a pathologist who interact with our pathologist assistant on a day-to-day basis, I cannot do my work without them. And I think pathologist assistant, it's a very interesting job and a very important one as well. Like, they really, make a, very big impact on especially like cancer diagnosis. So hopefully, after your presentation, you will pique your interest in this profession, which again, just like clinical biology, maybe not as well known as some other profession. And also just encourage all of you, obviously you have the chance to ask us any question during the Q&A session, but I also encourage you to check out our website where we really, work hard on make sure that the information up there is up to date. So just make sure you go on the website where you can see all our curriculum, so what you'll be learning and where you'll be learning and how you'll be learning it, and also any kind of rules and policy concerning our program. Okay, so that's what I'm going to say, and then I'm just going to pass the virtual microscope, I guess, to Will. So Will, you can go ahead.
Great, thanks, Fang. Again, appreciate the kind words that you said. That I also want to iterate that this kind of like PA pathologist partnership has been steadily maturing over the many years since the inception of the profession. So to everyone else here on this info night, I'm excited to talk to you guys about the PA stream of our Masters of Health Sciences program. So just a little bit about myself professionally. As Dr. Liu mentioned, I am the education and clinical coordinator for the PA field of the program. Primarily, I'm also a practicing pathologist assistant at Mount Sinai Hospital in Toronto. I did my undergrad degree also at U of T in 2008 in cell and molecular biology. And then I subsequently completed my master's studies as a PA through the Western program in 2010. And since then, I've had the opportunity to work in various community hospitals within the GTA, alongside with doing some forensic autopsies as well during, I guess, my junior years as a PA. And now I've sort of been at an academic hospital, which is what Sinai is for the past, I think this is my 11th year here. So, and then throughout my practices, I've completed my American and Canadian certification as a PA, which is the ASCP certification and the triple CPA certification. And so for the next like 10 minutes or so, I'd like to touch on a couple things to help everyone understand a little bit more about the PA field and highlight some key aspects about the PA profession and job prospects, going over what it's like to work as a PA and be part of our small community. We'll go over some of the skills that we think that are required to be a successful PA, and a little bit about our program specifically. and why our program is a little bit different and unique compared to the other PA programs out there. So, so who are PAs and what do we do? I think the best definition of what PAs are that we are highly trained lab and healthcare professionals, and we act more as physician extenders to pathologists. We are members of the pathology team with practical knowledge of lab practices, as well as we have academic training in anatomy, pathology, and pathophysiology. So we kind of bridge that gap between a lab technician who is very adept in lab processes, but we also understand a lot of like the advanced trainings that some of the pathologists may have. So we sort of fit that kind of gap in between what a pathologist is and what a medical laboratory technologist is as well. Our main responsibilities clinically include providing accurate and timely processing of all pathology specimens. So what I mean in pathology specimens are sort of any wet tissue specimens that are collected from patients will always end up in the pathology lab. And PAs work under the supervision of certified pathologists. Generally speaking, our roles are primarily situated in either academic teaching hospitals or community hospitals. There's also a large number of PAs who work in forensic pathology services. And there are some private labs, private pathology labs specifically, that employ PAs in Canada. And if you look at the job of a PA, our role is really two sides of the same coin. And one side of the coin is what we call surgical pathology, and the other side is autopsy pathology. So for surgical pathology, PAs perform macroscopic examinations, documentation, dissection, and sampling of surgically removed tissue from patients. And these types of specimens can range from small sub-centimeter biopsies taken out for diagnosis to larger resections such as uteruses, colectomies, lungs and Whipple resections for malignant cases, for example, to something even bigger was what we call en-bloc or multi-organ resections for those unfortunate cases where we have locally advanced cancers. And then on the other side, PAs are also very involved in community or, sorry, I should say hospital or forensic autopsy duties, which would involve evisceration, dissection of organs, and sampling of procured tissues. We also do sampling of toxicologies for ancillary tests if they're required, and generally assisting any other duties that are required of us in the autopsy setting, as well as sometimes even rendering macroscopic diagnoses. So there are other important roles as well that PAs we end up going into, such as being a manager in a laboratory setting where we manage day-to-day workloads in the gross room or in the autopsy suite. As a lab expert, we sort of gain a better understanding of rationales of various lab tests, and we kind of leverage that knowledge to help advise clinical teams on terms of like what to kind of do in very specific cases. We're also very heavily involved in teaching pathology, specifically to even residents and fellows in pathology, PA students, and other allied health healthcare professionals, MLTs, MLAs. In some instances, high school students and university students may jump into the lab and sort of get a little bit of hands-on experience with us too. And some of the other things that we kind of dabble in, which would include research, quality assurance, and sort of being a consult as well, to kind of leverage our knowledge in pathology and lab practices. So before we go on, I'd like to kind of give everyone a brief overview in terms of what kind of happens in a pathology lab and how diseases are really diagnosed. So when when a patient kind of comes into the operating room, a surgeon or a clinician may remove either the disease tissue in question, or they take a sample of the area in question, and that sample makes its way into the pathology lab. And the first part of the pathology lab, the specimen ends up in, is what we call the gross room. And the gross room is kind of where the PAs like mostly reside, where we will physically handle the tissue, we will examine it, we will document and selectively sample the tissue if it's a larger piece. And then the tissue kind of goes through a whole host of different processes where it gets manipulated, processed, and gets embedded into blocks, where this is time for a different kind of lesson. But the tissues are then processed and cut into very thin slices, so about 5 microns in thickness, but thin enough that light can actually pass through. So the main idea of where the histology lab is that we're going to try and we're going to take the solid piece of tissue and change it into a microscope slide. So after we cut the slices into 5 microns, they're mounted on a glass slide, they're stained, so that we give some coloration to the tissue, and then that ends up on the pathologist's desk, where they are examined through the light microscopy, and a diagnosis can be generated. So that, in a nutshell, is generally what kind of happens in the pathology lab. So the PA profession has kind of been around, especially in the United States, for at least 30 years, but it's still a relatively unknown profession to the public, and even amongst our healthcare professionals. And as I kind of mentioned, it's sort of created as kind of a need to fill this kind of like unique gap in between a medical lab technologist and a pathologist. So we sort of act as that kind of liaison between the pathology lab and other departments. Generally speaking, the demand for PAs in Ontario and Canada has been quite high, and it still is quite high as well. The PA profession itself outside of North America is pretty much nil, but it is gaining interest internationally. Interestingly enough, our profession is unregulated compared to other medical professions, such as like nurses and RTs and other technicians. So we hope that as the profession kind of matures and continues to grow, this might change in the future. And similar to our CE counterparts, there's not very many of us in Canada, so this is one of the things we kind of pride ourselves in terms of we have such a small and tight-knit professional community that sort of everyone knows everyone, even if you're either within town or maybe you could be out of province as well. So through the conferences, we get to network and kind of be good friends for many years to come. So just a quick overview of our program. The first year consists of mainly our didactic courses, mainly in anatomy, pathology, bioethics, and biobanking, and other courses that you can see from our website. And in the second year, our students will transition from didactic lessons into what we call our practicum, or clinical placement, where our students will rotate through numerous clinical sites across the GTA. We're slated to include additional sites as well, outside of the ones that are listed on the screen here. At the same time, our students are also participating in a capstone research project that they kind of handle during their clinical placement. And at the same time, as if this program's not busy enough, all of our students also participate in weekly in-depth lectures that are given by practicing pathologists and PAs. So that happens basically all of that in tandem together on the second year. And as they kind of wrap up the program, as well as the capstone research project, our students also take a clinical lab management course as well. So just a couple pictures. This is a picture of our cohort of PAs who have just graduated. And one of the speakers who will who will be speaking with you, Paulina, is in this cohort as well. So we're just doing a specimen kind of demonstration with some of our practicing PAs at the university here. And this is another exercise that we kind of did just over in the late fall, where one of our current cohorts, we're doing a plasticine demonstration where we get the students to construct a Whipple's resection, which is a fairly complex surgical resection of the stomach, pancreas, duodenum. This resection is most commonly done for pancreatic cancers of the pancreatic head. So this is sort of like one of our ways to help illustrate the complex anatomy, but at the same time, think of it like a different way of applying practical knowledge to something a little bit more fun and hands-on. So, you know, I think I've highlighted some of the different things that kind of sets our program apart from other hospitals, our other PA programs. You know, being at U of T, you have access to a lot of these world-renowned pathologists that work all over the GTA. You get to sort of be a part of the team as well when you go through your clinical rotations. You know, I'm very proud and happy to say that this past May we've achieved full accreditation from NACLS, which is an accrediting body from the United States that accredit all of the PA programs within North America. So this accreditation gives our students the ability to challenge for the American and Canadian certification exams. Okay, so hopefully I've kind of given everyone a taste of what a PA is, and so these are some of the things to kind of think about if this is a field that you may be interested in, if you like doing hands-on lab work. There's a lot of stuff happening in the PA world. There's always something happening. It's high stress, it's dynamic, but honestly, I wouldn't wish to be in any other place other than this. It keeps me on my toes. There's always opportunities to kind of do continuous learning throughout your career as a PA. You know, if you're looking for a career that allows you to apply what you've learned directly to your vocational practices, this is probably a good field to think about as well, and honestly, to make a positive impact on patient care. These are just some of the resources that, if you're interested in reading a bit more about the profession, that's there for you. Okay, and great, thank you for your time, really appreciate it. And I want to pass it to Paulina.
My name is Paulina. Thanks for the introduction, Fang and Will. So I'm one of the 2023 grad students from the pathologist assistant stream. This is just a photo of me from the white coat ceremony. And I'm currently a full-time PA at North York General Hospital in Toronto. So I'll talk a bit about my academic background. I started out with my undergrad degree at Western University in 2017. And in 2021, I graduated with a Bachelor of Medical Science, and I did my honor specialization in pathology. So early on, I knew that pathology was a field of interest for me. I can't really tell you why I picked it or how. It was one of the options. And when I read about it online, kind of like the study of the disease and the fact that it's very visual, it just really appealed to me and to my skill set. So I went with that. And then I applied for the Masters of Health Sciences Pathologist Assistant stream at U of T for the 2021 entry. I found out about this program because, one of this program is also offered at Western University, and one of the days we kind of had one of these career days, and they talked to us about pathology and what are some potential careers in pathology outside of becoming a pathologist. And one of them was pathologist assistant. The program sounded really cool to me. I did a lot more research and I thought, like, this sounds exactly like what I wanted to do. So I ended up applying for that program, and I started at U of T in September 2021. And then flash forward to now, as of October, I've been working full-time as a PA at North York General Hospital in Toronto, but I actually started working here as a part-time PA as a student. So I also just put a bunch of my hobbies up on the screen, and that's just to say that one of the perks of being a PA is the work-life balance is great. we pretty much have kind of an 8-hour a day, an 8-hour work day, and that leaves you lots of time to pursue your other hobbies, and that's a great perk of the job. And then this is just a photo of my cat for fun. So I'll talk a bit more about why I chose the PA program. So like I said, I discovered the program through my undergrad degree, and what stood out to me about the PA career is that it's a very fascinating, at least to me, and an ever-evolving discipline. So it's a pretty new discipline, especially in Canada, and it's changing a lot all the time as more research and more applications are being discovered. And so you're constantly learning new things. You constantly have to keep up your skills and your knowledge, and I find that really rewarding and engaging. You also have a direct impact on patient care. So although we are behind the scenes and we don't see the patient, and the patient doesn't see us, they may not necessarily think of us. But as I always like to say, that kind of a lot of patients' journeys start out in pathology because that's where the diagnosis is made. So you do feel kind of that on an everyday basis, you are contributing to patient care. And that's a very rewarding aspect of the job. It's also a very fast-paced work environment. A lot of times you're multitasking, you have different things on your to-do list, and you're working in an interdisciplinary team with pathologists, nurses, surgeons, radiologists, and medical lab technicians and other healthcare professionals. So you kind of get to work with a lot of different people, get to do a lot of different things, and no 2 days in the PA job are the same, and that's great. Keeps you engaged, keeps you away from burnout, and just enjoying your job. And finally, it's a hands-on work environment, so you are literally working with your hands, as shown in these photos. You're cutting like you're cutting human tissue, organs, resections. And so if you like to work with your hands and you like a visual person, this is definitely a job to consider. So then I'll talk a bit about why I specifically picked U of T, or the U of T program. So the small class size, kind of Hannah touched upon the fact that the class size is really small. So we have 5 students currently in this program, and that's great because first of all, you get to work one-on-one with professors and really get to know them. And then you also get to get really close with your peers, the other 4 people in your program. And to this day, me and the 4 people in my program still talk every single day in our group chat and kind of like share aspects of our jobs and just catch up. We meet up all the time. So you do get to make great friends. This program emphasizes research quite heavily. So we do take a stats course, research methods course. We have capstone project that Will talked about. So if research is something that you like or are interested in, this could definitely be the program for you. Although research isn't the primary aspect of a PA, it does all of this research courses in the capstone project do give you kind of an in-depth understanding of pathology and also critical thinking, which is really important to the job. Next, one of the things that really stood out to me as opposed to some of the other programs in Canada is the fact that you get to rotate through a variety of hospitals rather than just being at one. And somebody said to me, like, you can almost think of all of these rotations as like mini job interviews or kind of like internships. You get to see all these different hospitals in the GTA and see the workflow there, meet the people. And through that, you can kind of see where you might be a good culture fit and where you might want to work potentially in the future. And like I mentioned prior, I started at North York as a student. It was actually my first rotation, and I really, really liked it there. And they actually ended up reaching out to me and offering me a part-time job, and that led to my current full-time job. So that's a huge perk of the Toronto program, is that you do get that foot in the door with potential jobs down the line. And finally, I found that the people who run this program are very dedicated. They supplement the courses with a lot of resources, modules. There's just so many resources to learn from, and they're all very happy to kind of provide extra information. They make the program fun, like what Will talked about, that little thing that we did with the Play-Doh, where we kind of were able to create like a fake specimen and then learn to gross it. So all of that made the program much more engaging and just a better learning experience. So now I'll talk a bit about a day in the life of a PA, and this is specifically for me because the day in the life of a PA really varies depending on where you work. So at my hospital, we don't do autopsy, so I'm strictly working in surgical pathology. So in the morning, we start the day by reviewing our big malignant cases with the pathologist and other PAs. And that's a great aspect of my job because as a new grad, I get to bounce off ideas off of my coworkers and also get their insight and get their advice. And that's really valuable to my learning because I'm still learning. And then I kind of just go through all my big cases and I gross them one by one. I dictate gross reports. At the end of the day, I'll work on my the smaller cases like the biopsies that Will talked about. I'll review and edit my gross reports. I'll make any diagrams necessary, and then I'll submit that. And then some ancillary duties that PAs may perform, depending on where you work and also depending on your experience and how long you've been a PA. So Will talked about this, you might be teaching students anywhere from high school students to medical residents. And then some PAs are also involved in inventory and purchasing and quality assurance and things like that. So that just depends on your lab. Finally, I'm just going to talk a bit about how you can be a successful candidate for your PA application. It's a really competitive program these days. So you might feel like the chances are low or something where it's like very daunting, and that's fair. But the most you can do is in your application and your interview is to be 100% honest, give the real reason for why you want to be a PA, because trust me, like the people that are reviewing your application can tell. Be yourself. And then everybody knows that one of the things that makes a successful candidate for any program is like extracurricular activities, and that's true. But the last thing you want to do is get involved in extracurricular activities just because you think they look good on your application. So my advice is always get involved in something that you are actually interested in and feel passionate about, because it'll help you actually stay in that, whatever it is. Like you're not going to just drop out as soon as you're kind of graduating, and you're actually going to enjoy it. It's not going to feel like a chore. And again, people who are reviewing your applications can tell when you're actually passionate about something or if you're just doing it for the application. And finally, and a really big one, is to familiarize yourself with what a PA does. It's a very niche field. A lot of people haven't really heard of it. And so in your application and your interview, you want to show that you actually know what a PA does and that that's something that you've looked into and can see yourself doing. So do some research online, watch some videos, talk to other PAs, and if you can, do some shadowing. I know it's not the easiest to get, but try your best and good luck. And that's all I have. Thanks for listening.
Thank you very much, Belina.